Okay, what is the most likely cause of this patient's postpartum hemorrhage? A 25-year-old woman gives birth vaginally to her first child. Immediately following delivery, she begins to experience excessive bleeding. The placenta is delivered intact, and her uterus is firm upon palpation. The patient's vital sign remains stable. Uh, which of the following is the most likely cause of this patient's postpartum hemorrhage? Okay. Okay. So my thinking is at first I was like uterine atony, but the uterus is firm upon palpation, so it can't be that. And then my next thought was retained placental tissue, but the placenta is delivered intact, so it can't be that. I think placenta accreta is not a postpartum issue, so it can't be that. It's not uterine atony, uterine inversion, or cervical or vaginal laceration. Uterine inversion, does that cause bleeding versus a laceration? I think that for sure causes bleeding. It may just be cervical or vaginal laceration, just may be to some issue leaving the during birth that like maybe he did something. So I would go with that.
Yeah, this is gonna be your best answer here. Okay, so let's talk about this, right? So, I can't remember. There used to be a mnemonic that I mean, what was the mnemonic? I can't remember now. Um,
Like the P's of the postpartum.
yeah, that's what it was. So walk me through kind of your P's, if you
Oh,
can.
I mean, what? So I don't know if it's A's or P's or which one it is. It's like uterine atony is one of the first ones.
Yep.
Retained tissue products.
Yep.
It's like the PID, the pelvic inflammatory disease,
Okay.
and then something else. I don't
Yeah.
know.
So one of the things is also you talk about bleeding disorders. I can't remember the exact mnemonic for something. It's like a certain letter, but for some reason it's like leaving my mind right now. But yeah. So the other thing is bleeding disorders, right? Like von Willebrand's.
Oh
Okay.
yeah, yeah.
So for instance, someone who hasn't ever been diagnosed before, like gives birth and their uterus is firm, the placenta is out, they don't have retained products, they don't have any kind of infections, right? Next thing you think about is, okay, do they have a bleeding disorder that we didn't catch before birth, right? So something that's on your differential. And of course, a cervical or a vaginal laceration, you're not really going to see unless you take deeper inspection, which can happen. Of course, if you have a really bad vaginal laceration, right, there's different grades, then you'll definitely see that and you have to repair it. But these are the things that you want to think about when someone has really, really diffuse bleeding after delivery.
For sure.